Hello, this lecture is about evidence-based practice. These are the learning outcomes for today's lecture. First, I want to start by differentiating between quality improvement, or QI, evidence-based practice, or EBP, and research. Many people have difficulty understanding the differences between these, but they are distinctly different. Quality improvement is about measuring outcomes or the results that you're getting. And when there is a negative outcome or you're not getting the results that you want, someone would do a root cause analysis to see what is causing the errors. So for example, you might have a fall policy that is implemented for an entire organization, and you find that one unit is having more falls than any of the other units. Well, you want to figure out why. Why are they having more falls if the entire organization has this same policy they should be following? So they would do a root cause analysis to see what's happening. What's different from that unit that's having more falls than the rest of the organization? They might discover that they're not implementing all of the policy, or they might discover that there's something structurally different about that unit that's creating more falls. But the goal of a quality improvement project is to figure out what's going on and why aren't you getting the results that you want to get. So you might want to improve efficiency. That could be the goal of a particular QI project, or it could be related to patient care, as the example I provided, such as reducing falls or maybe reducing infections. So that's an example of quality improvement. We're trying to figure out what's going on a specific unit or a specific hospital compared to another one. And why aren't we getting the results that we want to get, or how do we improve what is going on for a specific problem? Evidence-based practice, or EBP, has a broader scope. The focus here is using the best evidence that we have to guide our decision-making with patient care. Okay? Evidence-based practice includes the information that we have in the evidence, our individual expertise, and patient values. Because remember, it's patient-centered. Everything is surrounding the patient. So we are using research evidence to help make decisions about patient care. We don't do things just because, oh, that's what my coworker does, so I'm going to do it this way. Or this is how they've always done it, so that's how I do it. That's not evidence-based practice. We go to the literature, we go to organizations such as the CDC, and we follow the guidelines because those guidelines are based on research. So that's evidence-based practice. We are basing our nursing care on the best evidence available about what's the best way to do a particular thing. Now, research is about generating new knowledge. We conduct research to figure out what is the best way to do something. Research generates that evidence that is followed in evidence-based practice. Okay, you follow very rigorous rules when conducting research. There are rules around being able to conduct it and procedures, how you conduct it. It requires IRB approval and consent from participants. And you might have quantitative, qualitative, or mixed method research studies. Now, as I was describing, research uses systematic processes. There are strict procedures that you must follow for collecting data, how you analyze the data. It requires IRB approval. In other words, you don't just go conduct a study. It has to go to a review board, a panel of people that approve your study, and it allows you to collect data. It requires informed consent from participants. So when you guys were searching through the literature, searching the internet to collect information for writing a paper, and many of you said, oh, we were doing research on our topic. What you were doing is gathering information and searching the literature for information. You were not conducting research. So that's a bit of a misuse of the word, but it's very common. I talked about different types of studies. Research studies might be classified in these three different ways. Quantitative means you're collecting numeric data, and you're going to use statistical procedures to analyze that data. Qualitative research is collecting narrative data from study participants. So they might be telling you their stories, talking about their experiences. The researcher might observe people in different situations and do written descriptions of what they're observing. So that's what narrative data means. It's using words versus quantitative is using numbers. So for qualitative research, you're doing content analysis. You're looking for patterns and themes in what you're seeing and hearing from participants. Mixed methods is just simply your research study involved both quantitative and qualitative methods. So using evidence-based practice is really a bridge between research and nursing practice, your actual hands-on care. The evidence is a bridge for providing the best possible care that you can. So, and that is the goal of evidence-based practice, to be able to provide the best possible care that you can so that you achieve the best outcomes for the patient. All right, the research gives you the evidence, in quotation marks, the evidence for the best way to take care of a patient. So it's important to just understand some concepts here. Research provides validation for your nursing actions. It's why you do what you do versus just doing it by trial and error, making it up along the way, or, well, this is the way it's always been done. That's the way she does it. It provides some validation for nursing. This evidence-based practice ensures some credibility for the nursing profession. Okay? Just keep those things in mind when you're out there practicing as a nurse. Use the evidence that is out there to guide your practice. Research offers validation for your actions. Evidence-based practice ensures credibility to the profession of nursing. And as I stated earlier, EBP has three components. It is the evidence that's out there, it is your clinical expertise, and it's the patient's values, because we don't just go do something because we think it's the best thing to do. The patient has to agree that that is what they want to do. They always have the right to refuse. So there are some barriers to evidence-based practice. People will say, oh, I don't have time. I'm too busy while I'm at work. and maybe patients don't want to do what is being recommended. You might not have access to the technology. Right now, you have access to the school's library and you can easily search for any articles that you want, and your place of work might not have that sort of resource. You might not have the skills and know how to find good evidence or how to evaluate it, right? This is something that we talked about earlier in the semester. What are good and reliable sources of information? So you're starting to learn that. You might not have support from supervisors or your organization or coworkers to make changes. People might have a negative mindset and resistance to change, right? People want to do just what they're comfortable with, and well, this is the way we've always done it. We call that sacred cows. This is the way we've always done it. This is how we're going to keep doing it. You might run into that kind of attitude. So those are some barriers to evidence-based practice. However, it's important that we give good patient care. So even though you might face this, you should push back against it in appropriate ways so that you can provide the best patient care possible in your organization. So now you might be wondering, how do I even do this? How do I incorporate this into my nursing practice? Well, first of all, I've talked earlier about joining a professional organization that aligns with your area, your unit. So if you're on the oncology unit or you're on the renal unit or med surg, there are nursing organizations specific to all of these units. You join the nursing organization, you will receive their journal. Their journal will be filled with research articles about your particular area and what are the best ways to take care of your patient population. So then you start with a question. You would have some kind of issue that you're seeing in your patients, and you want to know what's the best way to do it. Here's an example of a PICO question. P stands for population or your patient population. I is the intervention compared to something else. And is it going to give me the better, which one gives you the better outcome? That's your desired outcome, and a time frame, which you don't always have a time frame for every question, but sometimes that's appropriate. So in Mexican American male adults, that's your patient with lupus, okay? How does cortisol, corticosteroid, that's your intervention, compared to this immunosuppressive therapy, that's what you're comparing it to, affect kidney function? So you're searching the literature for these two interventions to see which one has a better outcome. That would be a PICO question. I take care of these patients, and which one of these interventions works better for improving kidney function? So that's the first step in evidence-based practice. You identify an issue that you want to explore for a particular patient population. Does this approach work better than that approach on kidney function in this particular example? Okay. So that's how you might approach an issue. Does this work better or does that work better to improve some particular outcome for a particular patient population? That is an evidence-based practice PICO question. So then you search the evidence, reading through the literature, in other words, about this particular topic. And of course, you have to evaluate the quality of the evidence. So are we just going to Google and reading anything that we run across? Or are we finding sources of information that are expected to be trustworthy and vetted. So, nursing journals or sites like the CDC, websites like that. So once we gather the information and kind of make a decision, well, it seems like this approach works better than that approach, you would integrate that into your practice, okay? As long as patients agree to it, and of course you would have to get that approved, starting with your unit, your manager, your director. You could make this proposal. You would bring the evidence forward. This is what I've found, and I think we should be paying attention to this. Maybe we want to switch to this approach instead of the other approach. And then you evaluate patient outcomes. Well, let's see, is kidney function better doing it this way than that way? Okay, and then you would share that out to the rest of the organization. If that was a project you had done just on your unit, that might be shared out with the larger organization. That's what disseminate results means. You would share how it turned out. Did it make a difference? Was it better? Was it not better? So regardless of the results, you would share those results out with others. Through evidence-based practice, we improve patient care. So if you did this on your unit and found out that you've discovered a better way to take care of a patient and come out with better outcomes, you shared that out through the organization, that change could become part of routine practice across other units. So think about HCA, that's a large national healthcare organization. If you did something like that on one unit in one hospital and then this was shared out through the organization, you're impacting patient care across the country. And overall, patient care and outcomes improve because of an evidence-based practice project. Here are a couple of examples of evidence-based practice in nursing and the kinds of changes that can be made. All the way back to Florence Nightingale, she discovered that keeping a clean environment and washing your hands improved patient outcomes by reducing infections. That was during the Crimean War. Ventilator-assisted pneumonia. Nurses used research to change patient care and reduce the incidence of pneumonia. What they found was elevating the head of the bed and fewer circuit changes, and also providing interruptions in sedation reduce the rate of ventilator-associated pneumonia. So these practice guidelines came from nurses using evidence-based practice.